Are you over 70 and waking up with a stiff back every morning? Maybe you notice pain when bending to pick something up, or discomfort after sitting for long periods. You're not alone. Millions of seniors in the United States face this exact problem. The good news is, back pain is not something you have to accept as normal for your age. In fact, gentle movement, targeted exercises, and small daily changes can dramatically reduce pain, increase flexibility, and help you regain independence. Today, I'll guide you through natural, safe solutions and simple home exercises specifically designed for seniors over 70. By the end of this video, you'll have a routine you can start today that strengthens your back, improves posture, and makes daily life easier. Understanding the problem. Back pain in seniors is very common, and there are several reasons why it happens. As we age, muscles naturally weaken, especially the core and back muscles that support the spine. Discs between the vertebrae lose some of their water content and elasticity, which can reduce shock absorption. Sitting for long periods, whether watching TV, reading, or using a computer, puts extra strain on the lower back. Poor posture, like slouching or leaning forward, can worsen the problem. Even simple daily tasks like bending to tie your shoes or reaching for a shelf can become uncomfortable if your back muscles are weak. Many people over 70 rely on medications to mask pain or avoid movement altogether. But inactivity often makes the problem worse. When muscles aren't used, they lose strength, flexibility decreases, and the spine becomes more prone to stiffness or injury. That's why the most effective approach is gentle, consistent movement. By doing exercises that strengthen the core, improve flexibility, and stretch the spine, you can reduce pain and maintain independence. You don't need expensive equipment or intense workouts. Even a few minutes a day of low-impact exercises can make a huge difference in your quality of life. Solution. The exercises I'll show you today are specifically designed for seniors over 70. They were gentle, safe, and easy to do at home. The goal is not to push your body to extremes, but to gradually strengthen the muscles that support your spine, improve flexibility, and reduce discomfort. These exercises will also help with balance, posture, and mobility, which are just as important as relieving pain. Some of the key exercises we'll include are seated cat-cow stretch. This is a chair-based version of the classic yoga stretch, perfect for loosening the spine and relieving stiffness. Supported bridge pose strengthens the glutes, lower back, and core muscles, which support the spine. Gentle pelvic tilt activates the core and stabilizes the lower back, reducing pressure on the discs. Chair-assisted child's pose, a gentle stretch for the spine, shoulders, and hips that helps relax tight muscles. We'll also cover optional variations and modifications to make each exercise safer and more effective. I'll guide you on how to structure these movements into a simple, daily routine that takes just 10-15 minutes. And don't worry, I'll include tips for posture, hydration, lifestyle changes, and habits that prevent back pain from coming back. The most important part is consistency. Even gentle exercises, when done every day, can lead to significant improvements over time. Imagine standing taller, walking with confidence, bending without pain, and enjoying your hobbies again. That's exactly what we're aiming for. Many people over 70 believe it's too late to improve their back health. But the truth is, the body responds to gentle, consistent movement at any age. Every time you do these exercises, you're strengthening your spine, improving circulation, and reducing tension in your muscles. Think of it like watering a plant. Small, regular care leads to growth over time. Start with just a few repetitions if needed, and remember that every small improvement counts. Even if you feel stiff today, these exercises will gradually help you regain flexibility and strength. Picture yourself in a few weeks, waking up without stiffness, walking more comfortably, and enjoying everyday tasks without fear of back pain. You don't need to rush or push too hard. The goal is to feel better, move safely, and build a routine that becomes part of your daily life. By the end of this video series, you'll have a complete, gentle routine specifically for seniors over 70 that strengthens your back, improves posture, and reduces discomfort, all from the comfort of your own home. So let's take the first step together and start your journey toward a stronger, pain-free back. Step-by-step exercises. plus routine. Now that we understand why back pain happens, it's time to take action. But remember, we're doing this gently, especially for anyone over 70. These exercises are low impact, safe, and can be done right at home without any heavy equipment. Each movement is designed to strengthen your core, improve spinal flexibility, and reduce stiffness. Today, I'll guide you through each exercise slowly and safely, including tips on posture, breathing, repetitions, and variations so you can customize them for your comfort level. Exercise 1. Seated cat-cow stretch. Purpose: loosens spine, improves flexibility, and eases tension in back and neck. Step-by-step instructions. Sit on a sturdy chair with your feet flat on the floor, hip-width apart. Place your hands on your knees or thighs. Inhale slowly as you arch your back, lifting your chest slightly and looking upward. This is the cow part. Exhale as you round your spine, tucking your chin toward your chest and gently pressing your lower back against the chair. This is the cat part. Repeat slowly for 8 to 12 breaths, focusing on smooth, gentle movement. Move only as far as is comfortable. Focus on your breath. Inhaling deeply opens the chest. Exhaling releases tension. Pause if you feel any discomfort. Variation. If sitting upright is difficult, use a chair with a backrest for extra support. Exercise 2. Supported bridge pose. Purpose: strengthens lower back, glutes, and core muscles, helping support the spine. Step-by-step instructions. Lie on your back with knees bent, feet flat on the floor, hip width apart. Place a small pillow or rolled towel under your lower back for comfort. Press through your heels and gently lift your hips a few inches off the floor. Hold for 3-5 seconds, then lower slowly. Repeat 6 to 8 times. Tips: keep movement slow and controlled. Engage your core but avoid overarching the lower back. Focus on lifting gently, not pushing beyond comfort. Mini bridge. Lift hips only slightly if full bridge feels challenging. Hold longer, 5-10 seconds, as strength improves. Exercise 3. Gentle pelvic tilt. Purpose: activates core muscles and stabilizes the lower back. Step-by-step instructions. Lie on your back with knees bent and feet flat. Inhale, then exhale as you tighten your abdominal muscles and gently press your lower back into the floor. Hold for 3 to 5 seconds, then relax. Repeat 8-10 times. Tips: move slowly and focus on gentle contraction. Keep your head and shoulders relaxed on the floor. Stop if you feel sharp pain. Place a small pillow under your head or knees for extra comfort. Exercise 4. Chair-assisted child's pose. Purpose: stretches the spine, shoulders, and hips, relieves tension safely. Kneel on a mat, placing a sturdy chair in front of you. Rest your hands on the chair seat and gently lean forward. Keep your hips back toward your heels and forehead relaxed. Breathe deeply and hold for 15 to 30 seconds. Repeat 2 to 3 times. Adjust the distance from the chair to suit your comfort. Keep movement slow and controlled. This is perfect for seniors who have difficulty kneeling fully on the floor. Use a yoga block or stack of towels instead of a chair. Daily routine structure for seniors. 70 plus. Frequency: 4 or 5 days per week. Duration: 10-15 minutes per session. Seated cat-cow stretch, 8-12 breaths. Gentle pelvic tilt, 8-10 reps. Supported bridge pose, 6-8 reps. Chair-assisted child's pose, 15-30 seconds, 2 to 3 repetitions. Tips for best results. Warm up gently before starting, e.g., slow marching in place for 1 to 2 minutes. Stand up and move every 30 to 40 minutes if sitting for long periods. Maintain good posture throughout the day, shoulders back, chest lifted. Hydrate properly. Water helps cushion the discs and joints. Listen to your body. Don't push through pain. Track your progress daily. Even small improvements count. Imagine the freedom of walking without stiffness, bending without discomfort, and enjoying hobbies again. Celebrate consistency, not perfection. Your back will improve gradually. Advanced variations, common mistakes and lifestyle tips, expanded for 70 plus. You've started your gentle routine, and maybe you're already feeling a little more flexible or less stiff. That's fantastic. But to keep progressing safely and prevent future back pain, there are a few advanced variations and everyday habits you can adopt. These are still gentle and safe for seniors over 70, but they add extra benefits like improved balance, stronger core support, and better posture. In this section, I'll guide you through these variations, show common mistakes to avoid, and share simple lifestyle tips that help protect your back throughout the day. Small changes make a huge difference over time, and they're easy to incorporate. Advanced variations. 1. Mini bridge with pillow support. Purpose: strengthens glutes and lower back without straining the spine. Lie on your back with knees bent and feet hip-width apart. Place a small pillow under your lower back for support. Lift hips slightly higher than in the basic bridge. Hold for 5-8 seconds, then lower slowly. Repeat 6 through 10 times depending on comfort. Tip: focus on slow, controlled movement. Stop if you feel any sharp pain. 2. Seated side bends. Purpose: improves lateral flexibility and stretches oblique muscles gently. Sit on a sturdy chair with feet flat. Slowly lift your right arm overhead and lean gently to the left. Hold 5-10 seconds, return to center. Repeat on the other side. Do 5-6 reps per side. Tip: don't reach too far. The goal is a gentle stretch. Use the chair for stability if needed. 3. Heel slides. Purpose: activates core, improves hip mobility, and gently strengthens the lower back. Lie on your back with knees bent, feet flat. Slowly slide one heel forward along the floor until the leg is almost straight, then return. Alternate legs for 8-10 reps per side. Tip: move slowly, focusing on controlled motion. Keep your back gently pressed to the floor. Even gentle exercises can be less effective or risky if done incorrectly. Here are common mistakes seniors over 70 should avoid. Moving too fast. Rapid movements can strain muscles and joints. Always move slowly and deliberately. Overextending. Stretching beyond comfort can injure ligaments or the spine. Respect your range of motion. Holding breath. Remember to breathe throughout. Inhale to prepare, exhale to move or stretch. Skipping rest. Older adults need recovery. Avoid doing the routine on consecutive days if sore. Ignoring pain signals. Sharp or sudden pain is a warning. Stop immediately and modify exercises. Poor posture. Even outside of exercises, slouching or hunching can undo your progress. Lifestyle habits to prevent back pain. 350-400 words. Daily walking. Short, gentle walks, 5 to 10 minutes, several times a day, improve circulation and keep the spine mobile. Posture. Awareness. Sit tall with shoulders relaxed, avoid slouching. Use supportive chairs with lumbar support. When standing, distribute weight evenly on both feet. Hydration and nutrition. Drink enough water daily. Proper hydration keeps discs and joints healthy. Eat anti-inflammatory foods. Turmeric, ginger, salmon, leafy greens. Sleep in mattress. Support. Use a medium firm mattress or add a lumbar pillow if needed. Sleep in a position that keeps the spine neutral, on your back with a pillow under knees or on your side with a pillow between legs. Movement breaks. Avoid sitting for long periods. Stand, stretch, or walk every 30-45 minutes. Incorporate gentle stretches like shoulder rolls or seated twists during the day. Celebrate consistency, not intensity. Imagine bending, reaching, and walking without discomfort. Your body is capable of this at any age. Track progress. Note improved mobility, less stiffness, or reduced pain. Your journey to a stronger, healthier back doesn't stop here. The exercises you've learned, combined with these simple lifestyle habits, can protect your spine and reduce back pain for years to come. Remember, over 70 doesn't mean your body can improve. It just means you need to be gentle and consistent. Every small effort counts. Picture your daily life a few weeks from now, walking with confidence, bending without fear, sitting and standing comfortably. These are not just exercises. They are investments in your independence, mobility, and quality of life. Stay consistent, listen to your body, and remember, every gentle movement you do today is helping you live a more active, pain-free tomorrow. Daily schedule and long-term benefits. Expanded for 70 plus. You've now learned gentle exercises, advanced variations, and daily habits that protect your back and reduce pain. But to make all this stick, it's important to tie everything together into a clear, consistent routine. Today we'll go through a full recap of the exercises, how to structure them into your day, and tips to keep improving safely. This will help you not just relieve back pain, but prevent it from coming back, regain your confidence, and enjoy a more active, independent life, all at home in just 15-20 minutes per day. Warm-up. Seated cat-cow stretch, 8 to 12 breaths, sitting tall in a chair. Focus on gentle spinal movement and deep breathing. Opens the back and shoulders, preparing for other exercises. Core activation. Gentle pelvic tilt. 8-10 reps, lying on your back with knees bent. Engages core muscles, stabilizes lower back. Keep movements slow and controlled. Avoid any jerky motions. Strengthening. Supported bridge pose. 6 to 8 reps, lifting hips gently with pillow support. Strengthens glutes and lower back to better support the spine. Optional mini bridge variations for gradual progress. Flexibility and relaxation. Chair-assisted child's pose. Hold 15-30 seconds, 2-3 repetitions. Stretches spine, shoulders, and hips safely. Mini bridge for added strength. Seated side bends for lateral flexibility. Heel slides for hip mobility and core activation. Morning routine, 10-15 minutes. Start with seated cat-cow to loosen your spine. Follow with gentle pelvic tilt to activate the core. Add supported bridge pose for glute and lower back strength. Finish with chair-assisted child's pose to relax muscles. Afternoon routine, optional 5 to 10 minutes. Short walk indoors or outdoors for circulation. Gentle stretches like shoulder rolls, seated twists, or side bends. Use this time to reset posture if you've been sitting long. Evening routine, optional 5 to 10 minutes. Repeat a shorter version of your main routine. Focus on deep breathing, slow movements, and relaxation. Helps ease tension from the day and prepares for better sleep. Track your progress in a notebook or phone. Adjust repetitions, holds, or timing as strength and flexibility improve. Incorporate movement into daily tasks, bending, reaching, standing. Avoid skipping days. Even 10-15 minutes daily is more effective than long sessions once a week. 1. Reduced back pain. Gentle, consistent exercises strengthen the muscles supporting the spine, reducing stiffness and pain over time. 2. Improved mobility and balance. Exercises like seated stretches and mini bridges improve balance and flexibility, lowering the risk of falls. 3. Better posture. Daily practice reinforces proper alignment, preventing slouching and tension in the back, shoulders, and neck. 4. Enhanced independence. Strengthened core and back muscles make everyday tasks easier, standing, bending, reaching, walking, and sitting comfortably. 5. Improved sleep and energy. Gentle movement and reduced tension in the spine promote better sleep quality and overall energy levels. Imagine waking up tomorrow without that stiffness in your lower back. Picture yourself bending to tie your shoes without wincing, walking around the house with ease, or enjoying a short stroll outside with confidence. That's exactly what is possible when you commit to gentle, consistent movement every day. Many seniors over 70 feel discouraged, thinking back pain is just a normal part of aging. But the truth is, your body responds beautifully to the right exercises, no matter your age. Every gentle stretch, every slow lift, every mindful movement is helping your spine, your core, and your muscles become stronger. Over time, these small daily actions add up, and the results are life-changing. Celebrate each improvement, no matter how small. Whether it's standing a little taller, sitting a bit more comfortably, or walking further without stiffness, it all counts. So start today. Follow this routine, incorporate the lifestyle tips, and keep moving safely. Your back, your mobility, and your independence will improve more than you ever imagined. Age is just a number, and with the right habits, you can live a strong, pain-free, and active life well into your 70s and beyond.